And gentlemen, thank you for joining us today's webinar. You are very welcome for this very important discussion that we'll have this afternoon. You can see now that we have reached 100 participants, so we will go ahead and start the session. Today we are going to be discussing on knowledge, attitude, and practice of breast milk expression and storage among working mothers with infants below 6 months of age at public well baby clinics. This is a very interesting discussion that we are about to delve into, whereby we'll be discussing matters to do with breast milk expression and storage, a very important topic, especially for us young colleagues, for our young colleagues, for our working mothers. How do we do this better? What is the practice? What is the attitude? What is the knowledge about it? And we really do appreciate your presence in joining us for this. Today we have very robust panel. I will welcome them to introduce themselves. We'll start with Professor Musoke. Professor Rachel Musoke, who's a professor here at KNH, at University of Nairobi. Prof. Musoke, if you can say hello to us.
Good afternoon, everybody. I'm happy to be joining in this presentation. Breastfeeding and infant and young child feeding has been my pet subject for as long as I've been in pediatrics, and I'll be very happy to share my experiences with the rest of the team. But I believe the key presenter is Dr. Wanine.
Thank you very much, Prof. We're honored to have you, and I'm sure there will be some questions coming our way, which you'll be able to help us with. We have also Dr. Dr. Mary Wayego. Dr. Mary Wayego, you can say hello before our main presenter comes on.
Good afternoon, everyone. My name is Mary Wayego. I work in Pumwani Hospital. I'm a neonatologist, and probably relevant to this topic of today, I was part of the team that helped set up breastfeeding support and breast milk expression processing and storage at Pumwani Hospital. And the topic also is also very dear to my heart, because as a practicing neonatologist, we cannot overemphasize the importance of supporting breastfeeding for survival of the neonates. So I'm happy to be here and also to share my experiences. Thank you.
Thank you, Dr. Wayego. We now have our main presenter, Dr. Wanini Edemba, who will be sharing with us. Feel free to ask your questions and also comment in the Q&A section. After the presentation, we'll have a section of just going through that and just contributing to this discussion. Dr. Wanini, karibu.
Thank you very much. My name is Dr. Priscilla Wanini Edemba. I am a pediatrician. I'm doing my specialist recognition at Kenyatta National Hospital, and I'll be presenting about expression and storage of breast milk, a dissertation I did for my thesis, my MMed thesis. So karibuni. Thank you very much for this opportunity. So I'll start off the presentation. This was a dissertation I did as an MMed student, and my supervisors were Professor Gracie Rumu and Professor Rachel Musoke, both from the Department of Pediatrics and Child Health in University of Nairobi. I collected my data in Kenyatta National Hospital and also in Mbagathi Hospital. The title of my presentation is knowledge, attitude, and practice of breast milk expression and storage among working mothers with infants below 6 months of age at public well baby clinics. Oops, sorry. So breast milk expression can help maintain lactation in the event of an infant being separated from their mother. The Baby Friendly Hospital Initiative advocates for training of mothers on how to express and store milk. The guidelines actually state that at least 80% of mothers of preterm and term infants should correctly describe or demonstrate how to express milk. Exclusive breastfeeding has been found to be higher among non-working mothers compared to working mothers. Actually, studies show that there's a negative relationship between return to work and exclusive breastfeeding. In 2017, the government of Kenya enacted the Health Act in support of lactating working mothers through provision of lactation rooms and breastfeeding breaks. They actually describe a break of 1 hour in 8 working hours. We may not know that the Ministry of Health provided guidelines to employers on how to implement workplace support for female employees to achieve exclusive breastfeeding. Sorry for that. So a little bit on literature review. In Ghana in 2015, a study done among working women showed that 99% of mothers were actually knowledgeable on exclusive breastfeeding, but only 10% exclusively breastfed for 6 months. They said they had no other support from employers beyond maternity leave. A 2016 study done in South Jordan among working mothers also showed that working mothers had satisfactory knowledge and positive attitude towards breastfeeding, but only 20% exclusively breastfed for 6 months. A study done here in Kenyatta National Hospital by Dr. Gituma in 2016 titled Breastfeeding Experience Among Healthcare Professionals in Kenyatta National Hospital showed that 85% of female health professionals intended to exclusively breastfeed, but only 29% were able to do so for 6 months. And so, for that, my justification for the study was we have more women in the workforce, 47% in Kenya. And a study done by Philips Africa showed that 52% of working women actually resume work 3 months postpartum, forced by need to provide income. There is also political goodwill in Kenya in terms of we have the Breastfeeding Mothers Act by Honorable Sabina Chege, and also the Ministry of Health has guidelines for employers on how to secure or having a breastfeeding friendly environment at the workplace. So I saw a need to examine the practices and perception around storage of milk among working mothers. I also found myself as a resident having the same problem of trying to achieve exclusive breastfeeding or lactation management, yet I was in the Department of Pediatrics. So my primary objective was to assess the knowledge, attitude, and practice of breast milk expression and storage among working mothers with infants below 6 months of age in public well baby clinics. And the secondary objective was to determine the factors that affect this expression and storage of breast milk. So it was a cross-sectional study conducted in the Well Baby Clinic of Kenyatta National Hospital and Mbagathi Hospital. We had a sample size of 384 participants, 299 were from Kenyatta, and Mbagathi, we got 85 mothers. We included all mothers who were currently working or who had already returned back to work with children less than 6 months of age, mothers who were above 18 years and who, of course, gave us consent. But mothers who were allowed to carry children to work were excluded from the study, or mothers with contraindications to breastfeeding according to the WHO acceptable reasons for breast milk substitutes. So we did consecutive sampling for the participants who met the eligibility criteria. We had a structured questionnaire with open and closed-ended questions to establish the knowledge and attitude, while we used the Likert scale to score the mothers in terms of the attitudes. But in terms of the questionnaire, we used in terms of knowledge and practices, we used open and closed-ended questions. So I would like to explain that a bit. So we gave a score of 1 to each correct response, but a score of 0 to any incorrect or unknown response. We tabulated a median score, as you can see on the right on the graph, and we were able to distinguish, a median score is used to distinguish between satisfactory and poor knowledge. And our reference was the Academy of Breastfeeding Guidelines to give us the correct science or the correct response, what was correct and what was incorrect. So of course, the categorical variables are summarized by proportions and continuous variables summarized as a mean value. The inferential statistics were calculated using odds ratio and adjusted odds ratio. And for the odds ratio, and for univariate and multivariable analysis respectively, and data was presented by tables and graphs. So the mean age of mothers was 29 years. So these mothers were pretty young. The mean age of the children were 4 months. The age of the child when mother resumed work was actually 3 months. Most of the mothers, actually 52%, had achieved tertiary education. Most of them were multipara, so this was not the first child. And most of them at 76% were working in the private sector, but here we would need to consider that also this includes the informal sector. Out of all these mothers, only 41% were actively expressing milk either regularly or irregularly. 41% only. On the left, I drew a small table on the questions, specific questions that we asked, and we see the percentage of those who got right. Those who had satisfactory knowledge that breast milk expression can be done by hand or pump, were 97%. Those who knew correctly that you can store in the refrigerator or room air were 70%. Those who knew that the government had given directives to have lactation rooms were 62%. But if you combine satisfactory knowledge on expression and storage of milk, we are doing badly at 34%. And there's a graph also showing that on your right. In terms of factors associated with knowledge of breast milk expression and storage, or what was associated with a mother having good knowledge of expression and storage, we found that mothers who had attained tertiary education had significantly higher odds of having satisfactory knowledge, and also mothers who are working in the public sector. We can see that the ones who had achieved tertiary education had an adjusted odds ratio of 4.47. In terms of attitude, mothers generally have a good attitude. Towards expression, mothers knew that expression of milk can allow them to achieve 6 months of exclusive breastfeeding at 85%. However, the challenges that we noticed that were significant were 50% thought, or 51% thought that expression of milk is painful, and 7% thought expression of milk is cumbersome, or they have to come with a pump, they have to wash the pump, they have to, so some good percentage thought that expression of milk is cumbersome. Otherwise, in terms of attitudes towards storage, 88% had agreed in terms of that proper storage can actually help them achieve 6 months of exclusive breastfeeding. But if you look at the table, we see that 76% thought that storing milk is an expensive affair. So my sample size actually went up to 395 mothers, and only 161 were actively expressing milk. That is 41%. The most preferred method was hand expression, followed by manual pump. Electric pump was at 7%. Then in terms of availability of refrigerators, most mothers had refrigerators at home. At work, only 35% had refrigerators. But even those who had refrigerators at work, 35%, only 3% of mothers actually expressed milk at work. Most of the breast milk expression was done at home. So this was a Venn diagram showing the top 4 reasons why lactating mothers expressed and stored milk. And we see the topmost reason is the mothers wanted to delegate feeds to someone else as they try and achieve exclusive breastfeeding. 17% actually just needed to delegate these feeds, and 14% of mothers had been unsuccessful at breastfeeding in terms of either they had nipple problems or other problems. And we can see was the most reason, delegating feeds while trying to achieve exclusive breastfeeding. So when we evaluated the factors associated with breast milk expression and storage among working mothers, those mothers who had achieved tertiary education were 4 times more likely to express and store milk compared to their counterparts. And when subjected through a chi-square statistical analysis, there was statistically significant relationship between expression of milk and ownership of a fridge. So the conclusion of this study is most working mothers are not knowledgeable on expression and storage of milk. Remember, the Baby Friendly Hospital Initiative actually require us that 80% of mothers of preterm and term infants should correctly describe or demonstrate how to express milk. Having tertiary education and working in the public sector was associated with having satisfactory knowledge in breast milk expression and storage. Most mothers had positive attitude towards that they would achieve 6 months of exclusive breastfeeding through proper expression and storage, but the challenges experienced were pain and cumbersome, and they said that expression was cumbersome or fussy. The workplaces did not seem to provide adequate facilities to enable working mothers to express breast milk and safely store. Attaining tertiary level of education was associated with a significantly higher odds of expressing and storing breast milk. The topmost reason for expressing milk was to have someone else to feed the baby as they try and achieve 6 months of exclusive breastfeeding. Actually, the mothers who expressed milk were more knowledgeable compared to those that did not express breast milk. So my recommendations was special emphasis in health facilities need to be there to educate all mothers on expression and storage of milk. And we should teach them techniques of expressing milk. I think what I have come to know is expressing milk is a learned skill. It doesn't just come automatically. And this is important as the Kenyan government gears up towards setting up many more breast milk donation banks. The education of the girl child needs more serious consideration, as also as had attained tertiary education had significantly higher odds of expressing and storing milk. And the workplaces need to be compliant with the 2018 Kenya policy guidelines for securing a baby-friendly environment at the workplace. Provision of fully equipped lactation rooms and having expression breaks would help in encouraging more mothers to express at their workplaces. These are my references. I would like to thank my supervisors, Professor Rachel Musoke, Professor Gracie Rimu, the Kenyatta National Hospital for the chance to collect data, and all my research participants, and all the health workers that have gone before me who try and who we are together in trying to encourage mothers to achieve these 6 months of exclusive breastfeeding. Thank you very much.
Thank you very much, Dr. Onini, for that presentation. Indeed, we can see that despite the need for exclusive breastfeeding up to 6 months, you're having a challenge with that, especially for the working mothers, where maybe they don't have the knowledge, their attitude is not right, and the practice is also not right. And we really appreciate that feedback from that study. It's a really important study. And maybe what I'll ask the participants for question and answers, you can kindly comment at the Q&A section. Maybe let us know in your workplace, do you have measures? Have you put in place measures that support breastfeeding mothers? Do you have a breastfeeding room? Do you have a breastfeeding place? Do you get breaks? Are you able, as a working mother, if you're there, are you able to comfortably express and be able to achieve the 6 months of exclusive breastfeeding? We have to say that we commend also for Kenyatta National Hospital, We do have a breastfeeding place at the nutrition department, at the old hospital nutrition department. It does have fridges for storage. It's a very clean environment. If I had a picture, I would put it up here. From the nutrition department, they've really tried to make it a conducive environment for the working mothers in this place to be able to have a place where they can express their milk and they can store their milk and they can have a restful place. However, the uptake, I can say, is not yet very good. Maybe you'll get more data on that, but the numbers we have that visit the place is still a bit low, and maybe we need more advocacy on just people to know that this is available, and to influence the knowledge, the attitude, and the practice, as you say. Or maybe before we go to the questions, we can have comments from Professor Musoke.
Thank you very much. I
Oh,
just
you have a slide. Okay.
prepared a few comments. I believe, okay, not knowing what audience we have, I think it's important for us to explore why exclusive breastfeeding. Next slide. Okay. We are aware that WHO and of course our national program advocates for 6 months of exclusive breastfeeding, largely because, in fact, if we look back on the Sustainable Development Goals and the Kenyan Vision 2030, they are all in favor of this exclusive breastfeeding because it's very important for early neonatal growth, early child growth, neurodevelopment, and immune development. The goals, the SDG goals say survive, thrive, and transform. When we are talking about survival, we are talking of the survival of the young infant. Thrive means being well, and of course, ensuring that when these babies become adults, they will be a good earning. We also should remember that early infant feeding has lifelong protection. All these NCDs that we see in the adults actually starts when the way you are fed as an infant or a child. And we should not also forget that this exclusive breastfeeding is also beneficial for the mom. We won't be going to be into the details, but we know that both the baby and the mother benefits from exclusive breastfeeding. So next slide. Now, Dr. Wanini has already shown this. Now, when we look at this, this is now us as healthcare workers in KNH. We see that 85% of the people who are interviewed had intended to exclusively breastfeed for about 5 to 6 months, 85%. But when we see the next slide, you can see how many of us actually managed, and Dr. Wanini has already presented this data. Only 29% were able to actually breastfeed for the 6 months. Now, as healthcare providers, if this is our practice, how are we helping the moms that come to us? The next slide. So the reasons that the people who are interviewed were in that study, the reason they gave was that as soon as they resumed work, their milk supply went down. And many a times there were, about half of the people, about half of the people had special consideration on allocation of duties, in which meant that, since they were exclusively breastfeeding, they didn't have any preference in how they were handling their duties. Next one. I think we can skip that for the time being. So at that time, of course, we didn't have a lactation center as has already been said. So the recommendation from from the healthcare providers in KNH was to develop a policy which for the health professionals that takes into account their work schedule, provides nursing rooms and breast milk storage. Okay, next one. Now, when we talk about women and work, we have to remember that women have always worked, and maternal protection from the International Labour Organization has been there since the 1918. I think that was the first time the guidelines came out. And of course, now we are well ahead, and we are aware that the Kenya has the law on work. Now, the KNH status has already been stated. We know we have a room, but this room is only open during the working hours, meaning no, and you know, as healthcare workers, our working hours is 24 hours a day. So if this room is going to be open from 8 to 5 or thereabouts, it means that the other healthcare workers who are working beyond 5 are not going to be able to use that room. So that's something that probably KNH as a health institution needs to see how we can provide a space for all the women who may be having babies, who may be working outside of the normal. In fact, when we say normal working hours for healthcare providers, I don't know what to say. Work because the office people work 8 to 5. Us, we work 24 hours a day. So basically, I wanted to lay a bit of background so that as we discuss, we know where we are. And we really need to work hard. Now, it's said that charity starts at home, and sometimes we do as I say or not as what I do. So if us as healthcare providers are not able to do that the 6 months, how are we going to influence the people we look after? How many of us as healthcare providers actually know the actual technique of expressing breast milk and storage? I know we have been conducting breastfeeding courses for KNH, but that also has been touching only the people who are in maternity, people in pediatrics. What about the colleagues in other departments who are not necessarily looking after mothers and children, but would want to learn how to do? So all those are things that we probably need to sit down and see how can we, as an institution, work out a policy that not only for our patients, but for the healthcare providers. In fact, as the employer should not forget that the workers are there providing something for the workers is very, very key for satisfaction of being able to work adequately. Many of us, when we are working, and you have a small baby, your mind is half at the workplace, but you are now worried what's happening to my baby. Probably I can pause there for now, and then we can continue with the discussions.
Thank you, Prof. Musoke, for that presentation on the importance of breastfeeding and exclusive breastfeeding. We will now go to some of, I'm seeing comments coming in regards to breastfeeding and the need for breastfeeding and exclusive breastfeeding and the support for the same. One of our presenters, an anonymous attendee, is telling us that strengthening health education and promotion services is very key to address knowledge, practices, and attitude gaps. We would love to see the strong advocacy surrounding breastfeeding and as well strong integration of breastfeeding with other mothers. That's very important. Thank you for that. Also from Samuel Kyoko, there is need for more advocacy in our health institutions in Kenya because very few have facilities measures to support breastfeeding mothers. So do let us know if you have some of these measures in your institutions. It will be good to know what is being done also in other healthcare facilities. So to some of the question, maybe Dr. Wayego, if you have a comment, maybe before we delve into the questions.
I think we can go ahead with the questions. The comments will come as we address the questions.
Okay. Maybe we can start off, you can start off with, you can answer for us. This one, there's someone asking about COVID-19 pandemic, comment on how safe it is for breast milk. And I guess he or she's asking about the storage of the milk, maybe in the workplaces and this COVID-19. What are some of the measures that can be put in place to ensure safety of the storage? Thank you.
So just to mention, so far there's been no documented active transmission of COVID through breast milk. They have found particles of COVID in breast milk, but that has not been confirmed to be transmissible, to be a live virus that can transmit COVID. Now the measures around, and of course what the recommendation is for mothers who can breastfeed or can express breast milk and have their babies fed with the milk, that is what is encouraged. Now the measures around ensuring safety, just being very cautious, is, for example, if the mom is expressing say milk and having it transported to go and be given to the baby who might be sick and separated from herself, is to just ensure that the contact, that the bottle and the surfaces from which there's been touch have been contaminated, and the mom observes the IPC measures during expression. So it's just maintaining IPC measures and ensuring that all the contact precautions around this, the expression bottles and the transferring milk from the mother are maintained. But it still remains the number one choice of feed even for COVID mothers. I hope that answers what the person was asking.
Yes, that answers it very well. We're getting a bit of background noise. I'm not sure if it's from our side or from your side. Yeah, I think Dr. Wayeko, you'll check on. There's a bit of background noise that was coming in, but you've been able to get the measures that you have commented on. Another question here is, for how long can a mother express? From Maureen Sang, I'm not sure how long can a mother express. I wonder what exactly you mean with that, but we can get that comment from Dr. Wanini together with the question that was asking on, I can just get it in a minute. Okay, maybe we can first answer that one. For how long can a mother express? And the question on for how expressive breastfeeding, is it after the 6th month or after the 5th month, when we say 6 months of exclusive breastfeeding? Maybe Dr. Wainene, you can help us with those.
Um, the question by Maureen San, how long can a mother express? What I would say is the WHO encourages all mothers to exclusively breastfeed for 6 months and continue with the breast milk from till 2 years of age and beyond. So here, I think even the maybe with time we need to change the name breastfeeding to breast milk, so that people can know that even if you can't breastfeed, you can still give breast milk till 2 years of age and beyond. That's what I would say in terms of how long can a person express milk. I can't remember the second question.
Yeah, perhaps before you leave that,
Yes.
let me add something. As long as a mom is going to be away from her baby, doesn't even if it's beyond 6 months, she can still express milk and leave it for the baby. But we zero so much on the 6 months, because this is where you are supposed to be doing exclusive breastfeeding. But as long as there's milk in the mom's breast, that it doesn't matter how old the baby is for her to be able to express. And perhaps what we've not talked about is storage. We should be teaching moms on how to store breast milk depending on the facilities they have at home. And there are very clear guidelines. Okay, if you don't have a fridge at home, you can leave your milk for, okay, research says about 8 hours, but people have gone beyond 8 hours and found that milk is still, breast milk is still safe. Personally, what I tell moms who don't have a fridge is the way we teach moms, people who are diabetic and are on insulin. We teach them how to keep that insulin cool in the house. The same procedure can be used to keep breast milk cool within our household. But if you have a fridge, depending again on the type of fridge you have, breast milk can be stored up to 6 months, 9 months, and beyond, especially if it is frozen. In the ordinary compartment, it's about 2 to 3 days. But if you're going to freeze, then you can freeze as long as you have space in your fridge, and this milk can be given to the mom, to the baby, whenever mom is away. Usually what I tell moms, the ones that I counsel, is that, okay, when the maternity leave, they start expressing and storing and freezing. Of course, putting a date so that when it starts to feeding the baby, you start with first in, first out. So the duration doesn't really matter too much.
Thank you for those comments, well answered. The second question that was related to that was from Gaudentia Afwande, who asks, um, sometimes it is not well understood by breastfeeding mothers, is weaning at 6 months or after 6 months? Kindly clarify. So there are those who wean after the 5th month, there are those who wait until after the 6th month. Any clarification on that, Dr. Wanini?
think I would like Professor Musoke to answer that.
Okay,
I
now
don't get
when
any.
we say 6 months, um, the baby, okay, let's say the baby is 5 months and 30, and 29 days. So when they reach, when they are exactly 6 months, that's when we say, okay, now we can start giving complementary feeding. Okay, so you don't wait for the 6 months to end, to finish, but you wait for the 5th month to complete, so that you are giving 6 months completed months, rather than because by the time the baby finishes the 6 months, he's going to be 7 months.
Thank you.
I
Thank you for
hope
that.
that answers the question.
Yes, that does clarify. I hope the participant has gotten that. I want to commend an anonymous attendee here who says, I've been pumping since 8 weeks postpartum when I got back to work, and I'm still pumping at 11 months. Really tough because I'm on the front line, but it is worthy. My baby is healthy and we are both happy. We are happy for you. Thank you for that. Indeed, it's challenging when we are it's challenging to express when we are at a demanding career, but we really appreciate those efforts by our moms to express and keep our babies healthy. We have a question here from also an anonymous attendee. What is the best time to express, and how do you increase the supply for milk so that you are able to express and also breastfeed? It's about our milk supply. Maybe Dr. Wayego would like to answer that for us.
Maybe
The,
before
sorry.
Dr. Wayego
Yes.
sorry, the health worker who has been pumping, I would like to say congratulations. In the new young moms coming up, we are really we are very happy expressing, but we forget that this milk is for the baby. I would like to encourage everyone, as you express and actually put on Instagram and all those things that you've pumped 6 liters, remember this milk is for the baby. So don't express and deny the baby. Express and make sure it's given to the baby. Thank you.
Okay, I'll go to the question of when is the best time to express, and say that there is really no best time, that you can say morning, evening, lunchtime. Each mother will usually find what works, but from from the experiences of mothers and their struggles, what comes first, it's important to first know that after the first weeks of postpartum, milk supply depends on demand. I think that is something that we really need, for us to support expressing milk, we really need to emphasize, because that fact does not come out very clear. The first few weeks, you have mothers getting engorged and a lot of congestion, because mainly the control and the influence is hormonal. But from there moving on, milk supply depends on demand. So having said that, there is really no time that you would say is a definite time that you can recommend, but depending on the mom's schedules and the mom's activities. But what most have swear by is when they have established their milk supply, sometimes they find it easy to say, for example, if they have a pump, to pump while the baby is breastfeeding, so that because the act of breastfeeding is comes with influences of the psyche and the hormones, and that's how you find that when breastfeeding on one side, the other side might start to leak. So you find that some say that it's more successful expressing while a baby is breastfeeding on one breast, but it's just to find a balance between the baby feeding and the baby and the mom expressing. I wouldn't say there is any specific time. The only thing I would emphasize is for us as we speak to the mothers is to mention to them and tell them that the more they express, the more they get more milk. Yeah, thank you.
Thank you for that, Dr. Wayeko. The more they express, the more they get more milk. We still seem to have a bit of background noise from your side. If you can have a look into that, there seems to be a bit of noise, but we could be able to get your comments on that. A question here from, we are getting quite a number of questions. Thank you, participants, for participating and for asking your questions and for your comments. So there's one from someone, oh, sorry. There's one from an anonymous attendee too. Can cow's milk be used in babies whose mothers are unable to have sufficient milk? How is it diluted? Maybe Prof. Musoke, you could help us with that.
Okay. First of all, it's going to be very much depend on the age of the child of the baby. If you are in the period of exclusive breastfeeding, of course, we would prefer not to give cow milk. Some of the reasons why we really discourage use of other milk in the first 6 months is besides all the things that I mentioned, sensitization, especially people, we know allergy and so forth usually starts because you are exposed to something, and the baby's gut in the first 6 months has not learned to close off proteins that might cause allergy in the baby. So we really usually discourage use of cow milk in the first 6 months. However, also ordinary cow milk, when you look at the composition, is not really suited, and especially so if you have a very young baby, and more so in the first month or so, when the baby cannot be able to handle the components in cow milk. So if a mom, if by any chance, and of course we know that there would be instances where a mom may not be able to produce enough milk. First of all, you want to work with her to find out why she's not producing enough. But if you've tried everything and she still doesn't have, of course, we are not going to say leave the baby to starve until you have enough milk. Then modified milk, which probably would call a formula, might be a little more suitable for the young infant than cow milk. However, we know that formula is extremely expensive for majority of women, and occasionally you find people have to resort to cow milk, but it will not be the best choice for us to recommend.
Thank you very much, Prof. Musoke, for that comment, and it really answers those questions very clearly. We have two related questions here. Dr. Wanini, you can help us with this. What method should one use to warm the expressed milk? And how can you know if the stored milk is safe for the kid before feeding the baby? How do you know if it is spoiled before feeding the baby?
So we are supposed to warm or thaw human milk over a period of 20 minutes in lukewarm water. So that is usually around 40 degrees. So that's what we are required to do. A practical what you can do practically is you can know how many packets of milk you need for the next day and just remove them from the freezer overnight and put them in the refrigerator, so that now when you remove a packet to thaw, you just thaw in lukewarm water over 20 minutes. You can use the back of the hand to test for temperature. So in terms of how you'd know that milk has spoiled is a question probably I would like either Dr. Mary or Professor Musoke to answer scientifically. But what I would say, stored milk or frozen milk usually have a different smell than the fresh mother's milk. But studies have shown that the smell does not prevent an infant from ingesting the milk. So that should not be a reason that a child refused to actually take stored milk.
Stored milk very rarely goes bad. What we know is that, in fact, because of the anti-infective properties of human milk, when milk is left on the bench, it actually kills the microorganisms that might have contaminated it. So it's very, very rare for stored milk to actually go bad. And I'm not aware of any anybody who has actually, maybe one can try and say, okay, I'll leave my a little bit of milk on the bench on outside of the fridge and see what happens, because I've not seen any milk going bad as long as it's as stored the way I mentioned earlier on.
Thank you. Maybe, Prof, on that note, you can comment again on how long the milk stays fresh on the different conditions. You said maybe at room temperature, on the normal fridge temperature, and when it's frozen.
Room temperature, from the studies that we have done, breast milk is safe up to 18, up to 8. Okay, the study that we did in KNH long time ago, we left the milk for 8 hours and it was still safe. There have been a few studies where people have gone up to 24 hours and is still quite safe for the baby. So if you are not going to freeze the milk, perhaps we could say not longer than 24 hours. If you're going to put it in an ordinary fridge compartment, which is usually about degree of about 4 degrees, then it is still safe up to 3, minimum 3 days. And as I mentioned, when you're going to freeze, it can be up to 9 months, depending on the type of a freezer that you have. Okay. So I hope that answers the
Yes, that answers two of the questions related to for how long we should store the breast milk. We have an interesting question where Theophilus is asking, can you expatiate on the benefits to breastfeeding mothers? So we've talked about the babies. Are there some of the benefits of breastfeeding, breast milk expression to breastfeeding mothers? With Dr. Wayego. Dr. Wayego, we're not able to hear you.
She's still muted. I don't know whether she's unable to mute.
Maybe she's unable
Unmute.
to unmute. Dr. Wanini, would you like to comment on that?
Sorry about that. Is the sound better?
Yes, we can hear you, but there's still some background noise.
Okay, the question was about benefits to the mother, and those are many. But just to mention is one of the benefits of breastfeeding, the act of breastfeeding, is actually psych. You'll realize when you've taken care of newborns and their mothers, one of the things that mothers look forward to is being able to breastfeed their babies. So the act of bonding and the act of knowing that they're able to provide for the needs of a baby, and that's very important to mothers. Then there is also the bit about breastfeeding being shown to be protective against cancers in mothers, and there's been documented. I mean, that's well documented that it's protective against breast cancer, and I think to some extent even ovarian. The other thing is it also helps moms, go back to their pre-pregnancy weight sooner. Yeah, because this breastfeeding also takes a bit of that extra weight that they might have gained. So those are some of the benefits of breastfeeding. Plus, of course, it's a free food, because funds that could be utilized to buy the supplements can be used for other activities that this mom can enjoy. So those are some of the benefits to the mother.
Yeah, probably to add on to that, we should not forget that exclusive breastfeeding is one way of preventing another pregnancy. If mom practices the way exclusive breastfeeding is, and in fact, some women, especially those who want to use natural methods, breastfeeding is one of the methods that helps them to delay another pregnancy, especially in the first 6 months. But also it has been shown that the bone density of women who actually breastfeed as they get older is a lot better than the women who never breastfed.
Thank you for that. I think I like the comment on the going back to the prepartum weight best. So there you have it, mothers. Don't be tired of breastfeeding. Our participants, thank you for engaging with us. We still can be able to see your questions, your comments. And our participants today are taking us from one corner to the other on matters breastfeeding. There's a question here from Simon Mulande. Hello, can the mother continue breastfeeding the baby after breast surgery secondary to an abscess? Maybe what are some of the contraindications to breastfeeding in that regard? Maybe Dr. Manini would like to take that.
So for mothers, the belly for when a breast has an abscess, that one we have to call in the surgeons and actually help the mother, because that means the breast has some pus. But where we have breast engorgement or sometimes mastitis, we still encourage the mother to breastfeed. But now now the mother has pus in the breast, now that's when we need intervention. And all these things can just be prevented by just teaching the mother how to correctly attach the baby to the breast, which as health workers, we assume that the mother knows. But actually, attachment of the baby to the breast can prevent all these breast complications, because by the time the mom was getting an abscess, the mom moved from mastitis to an abscess, and maybe it started with a crack of the nipple just because of poor attachment. So we should, as health workers, I know we are sometimes overwhelmed, but taking that precaution to actually teach the mom correct attachment of the baby to the breast helps us solve all of these issues.
Thank you for that. Maybe as a follow-up question is that one of the, what is the remedy for painful nipples? And I guess you've alluded to this when you say one of the causes of the painful nipples is an improper attachment. So what can be done to avoid maybe this painful nipples, and what remedy can be given so that our moms are able to breastfeed comfortably?
For me, I do not, I know there are so many things out in the market for you can apply this and apply this, but for me, I just use the mother's milk on the nipple. And the first foremost remedy for painful nipple is correct attachment of the baby to the breast, the baby to the breast, and so that the baby is able to open widely, and the baby is able to suckle the breast. So most of the things, even now, right now, as you go to the ward, you'll find out that many children are not attached properly, and the mothers come back with a painful nipple. But for me, I just, as a personal remedy, I just apply the mother's milk. I just tell the mom to apply, not unless my senior colleagues have any other method they use.
Miss, to have another comment on that, but thank you for that. Or Prof, you have something to add? Prof. Prof. Musoke will ask this. Will ask you this next one. There's a question
Sorry?
here. We'll ask you this next question about babies born preterm. Do we consider exclusive breastfeeding for 6 months since birth, chronological age, or corrected age?
Okay. We don't have enough studies, but people would advocate that you exclusively breastfeed for 6 months, not corrected age, but chronological age. So when the baby is 6 months, just like any other, I think that's what has been advocated. But probably we need to, yeah, I think that's what WHO recommends. You use 6 months irrespective of the gestation of when the baby was born. I mean gestational age.
The gestational
So
age.
we don't correct.
Thank you. Thank you for that. A question here. Maybe Dr. Yego can help us with this from an anonymous attendee too. Today we have a lot of comments and questions from anonymous attendees. What of mothers who can't breastfeed at all? What drug is recommended for stopping lactation? This is in cases where they have other medical issues. Dr. Mayego? Or maybe Dr. Wanini?
Yes, for those mothers who can't breastfeed, either the baby passed on, we have a drug which is a bromocriptine inhibitor. Can't remember the name because most of the time it's the obstetricians who administer it. But that is something, it's a drug that only the health worker or the doctor can prescribe it. Can't quite remember the trade name, but it's a bromocriptine inhibitor.
Yeah, if a mom, if there are absolute contraindication to breastfeeding, then this mom needs to be helped to for the baby to be fed alternatively. And this is where, as we look at the breast milk substitute act, that's where it's medically allowable for you to use a formula for the baby, because then uh, mom is not able to provide the milk, the breast milk. So there is that proviso, and we know we have our national law on appropriate use of breast milk substitute. And if there is absolute contraindication uh, for the mom to breastfeed, then we should be able to teach her how to safely use an alternative way of feeding the baby.
Thank you for that. And maybe I'll follow up on that, Prof. I have a number of questions asking in regards to the alternatives to breast milk. How early can one start the non milk? And if one is not able to afford non, what are the other alternatives that can be given to the baby?
Well, I would first of all avoid the word none, because there are other types of formula on the market. None is just one of them. Um, just as I mentioned earlier, any of the formula that are available in the market, they are basically the same composition and otherwise. And if mom's milk is not available, any type of formula can be used.
And in the case whereby they're not able to afford the other types of they're not able to afford formula.
If they are not able to afford formula, then as I mentioned earlier, I guess any other animal milk, cow or goat, can be used. But knowing that there might be complete, so one would have to look after that baby very well in terms of the health care provider who is following that baby.
Thank you. Yeah, indeed, we had mentioned it a bit earlier. Thank you, Bernard and Charles, for answering. They're telling us it's the drug is bromocriptine. Thank you. We are now coming towards the end as we wind up on the last round of questions for this session. We've had a wonderful time of just discussing and going into matters breast milk and breastfeeding all round, and we are really gaining a lot of knowledge from these sessions.
Just before you
Mhm.
we end, there's a
No,
comment
mhm.
from Susan Murithi, who is a member of the Kenya Breastfeeding Association, who says there's usually a milk collector that enables someone to collect milk as you breastfeed from one side. And what I would say about the milk collector is the good thing about the milk collector is you can easily clean it. You don't need electricity, and it's very practical. And thank you, Susan, for that comment or that reminder about the milk collector, so that we don't have to be pressed on having to buy electrical breast pumps or manual, but the milk collector is there in the market. It's very easy to clean.
Thank you for that comment. Thank you, Susan Murithi, for that. You're saying the silicone milk collector that will enable mothers to collect their milk better. A comment here from someone. There's a lot of I didn't exclusively breastfeed my adult children and they have been very healthy, etc. etc. This is the narrative that goes on around among our older mothers, and now the younger moms have picked it up due to influence. Thus, they don't bother expressing. How do we handle this? Guess here as healthcare workers or the frontliners, when you come across our young mothers, it's our duty to educate them on the things that you're learning here on the importance of breastfeeding. And you have seen not only for the baby, but also for the mothers themselves as well. So that as to be able to change these attitudes that you're talking about, to change the knowledge, the attitude, and the practice of breastfeeding. Uh, and something we've answered majority of these questions. We have comments about people from their health facilities, saying some of them do have the breastfeeding support others don't have. We have Faith Mogambi in Tenwek. We don't have any provision for breastfeeding mothers, cutting across staff and patients, and do not have refrigerators. And I guess this is cutting across a majority of our health facilities and not only our health facilities, when there are other working places, implementing correct the lactation rooms and supporting our young mothers with breastfeeding. It's still an ongoing work in progress. Even here in Kenyatta, we need to still advocate for more use of the lactation room, and I'm sure by the time we have more people aware about it and more support, we'll need to open up another space, because the need is there. The need is truly there, and we need to come up with innovative ways to support our mothers. I have a question here. How can we help a HIV positive mother who has a baby 3 months old? She's afraid of leaving expressed milk with the baby in baby care. She goes to work from 6:30 to 8 p.m. She cannot afford formula milk. This is from an anonymous person. Maybe you'd like more information on why is she afraid to leave the milk for the baby to breastfeed. Now, maybe Dr. Anini, you can just comment on that, how we can
So
help maybe our HIV mothers.
thank you for the question. I think the problem here is lack of knowledge of the caregiver who is left with a baby, or the daycare centers, because we've had that problem where the HIV positive mothers leave their children, leave their milk with the caregiver so that they can be given, but the caregivers are afraid to give the milk because they think they'll get contaminated and actually eventually get HIV, which is not the case. We know that even in this day and age, we actually give prophylaxis for the children. We also give ARVs to the mother. And I don't think anyone should be afraid of milk that is from a HIV positive mother. So I think it's educating the caregiver to actually just give this milk, because there's no reason why we have to add an extra cost that is not actually based on anything that is true on the mother. And actually you say that the mother cannot afford formula. So it's just an issue of lack of knowledge and fear of the caregiver. So the caregiver should just be enlightened that she'll not get contaminated. And actually this milk is good for the child.
Yeah, our national guidelines in terms of HIV is moms should breastfeed just like any other woman who is whether there is HIV or not. But we should be stressing very well that mom must get take her ARVs as prescribed, and then from there the fear of mother to child transmission is actually much reduced. But mom must adhere to her medication as she continues to breastfeed, and of course attend the wherever she's being cared for, to ensure that her viral loads, we are supposed to measure the mom's viral load every 6 months, as long as she's still breastfeeding, to ensure that she's virally suppressed. So there should be no difference between a mom who is HIV and mom who is not HIV in terms of exclusive breastfeeding, continued breastfeeding, as far as our national guidelines are concerned.
Thank you for those comments. We are now coming towards the end. A comment on the earlier discussion about the breast pump on the milk collector. So someone saying that the problem with the milk collectors that might discourage mothers from using it is in the manufacturer's instruction that says milk collected from the baby should be discarded and not fed to the baby. I'm not sure about that, but Susan, already you can take note of that. You've also commented here that, yeah, you do have an association in Kenya that supports breastfeeding moms across. That's really great. So there's Kenya Association for Breastfeeding. Need support as we need to support moms, even when the as we need to support moms, especially moms who are looking for help at home. Our attendees can note that. So as we wind up, we'd like to have our last comments from our panelists. We'll start with Dr. Wayego, Dr. Mary Wayego. You can give us your comments.
Yeah, I think as healthcare workers, we should, normalize the discussion around supporting breastfeeding, and by supporting breastfeeding, we by supporting breast milk feeding. So by that we mean both breastfeeding as well as moms expressing and having their babies fed on their own milk. It's as much as when we come and when babies and mothers come to us for reviews, and when we are discussing about vaccinations and development and the kind of discussions that we usually have and the kind of counseling that we have, this topic should also be introduced that early, so that mothers know that there are options, and they are able to breastfeed their babies. We should also, in our workplaces, have this as culture, so that mothers know that it's something that is advocated for, and knowing the benefits, and knowing what they need to do. We don't often talk about, there are those comments that I've mentioned about, there are people who are formula fed and they're okay. We don't talk about just the benefits of breast milk. Of course, we want the baby to benefit, but there is also many other benefits that even encouraging and supporting breastfeeding at a hospital level gives. You can talk about saving on cost in terms of hospital care, in terms of cost of buying formula. There's many other benefits that, as we advocate for this, we also know that to the system it is also beneficial. So those would be my comments, and I would just like to emphasize a bit about normalizing expressing milk. It should come as second nature, that when we have our 2 weeks reviews with mothers, this is part of the discussion that we should actually initiate. Yeah, thank you. It's been a very rich discussion this afternoon.
Thank you, Dr. Wayego, for those comments. Dr. Wanini, you can give us your final comments.
I would like to emphasize that expression of milk is a learned skill. We should not assume that a mother generally knows how to express milk, just the way we should not assume that a mother knows how to latch the baby on their breast. I would like to encourage the Kenyatta National Hospital to actually give more knowledge in terms of where the expression station is, so that all mothers know where it is. Like you can spread word around and tell us like where exactly that is. And lastly, I would propose that the Ministry of Health revises exclusive breastfeeding to exclusive breast milk feeding, because that will actually include everyone. Those who are able to actually latch the baby on the breast, and those who can give the baby expressed milk. Thank you for your attention, and it was a good enriching discussion. Thank you.
Thank you, Dr. Wanini, for those comments and for your presentation and your study. You've learned a lot from it. Prof. Musoke, we'll now hear from you.
Okay, it's been a pleasure being part of the discussion process. I would want to, for those of us who are healthcare providers, first of all, we are mandated to support, promote, and protect breastfeeding. Secondly, as we do that, we forget that women make their choices as they attend our antenatal clinic. Now, during the antenatal visits, there are few things that don't get done. Teaching the mom how to position and attachment should be an antenatal uh, should be shown during the antenatal visit. And then you start talking about breast milk expression and storage again during the antenatal period. The other thing that usually doesn't happen in the antenatal period is actually examining the breast, because you want to make sure that that breast, as soon as the baby comes out, that baby would be able to, so you would have already noted if the mom had, uh, might experience, for example, if mom has a flat or retracted nipples, that mom need to be flagged off that, so that when she comes to deliver, somebody knows that this mom might have problems in putting the baby on the breast. Um, and she's given extra help. So antenatal preparation is very, very key for us to have a good journey through the baby, because most often when the mom has had a normal delivery, they're home within 24 hours. So you don't have all the time to teach her all the things. But if she's been taught in the antenatal clinic, I think this is one of the things that we really need to emphasize. And our mother baby booklet actually is a very good uh, uh, thing to go through, because all those things are mentioned in the mother child booklet, what you should do during the antenatal and postnatal follow-up. So we should also be encouraging the moms, because majority of the women we look after are literate. We should be encouraging them to read that book. There's a lot of knowledge in that book.
Thank you very much, panelists, for that rich discussion and for taking us through breastfeeding and breastfeeding, the knowledge, attitude, and practice of breast milk expression, and all matters breastfeeding. We really do appreciate. We appreciate our panelists for keeping us engaged and for being with us till the end of this session. Just asking for the Kenyatta National Hospital breastfeeding room for healthcare workers. It is at the old hospital. At the old hospital, at the nutrition department, you'll be able to be directed to the room there, and it has some space there. It has a refrigerator, some couches there, and we'll actually ask them to come and have a presentation, maybe, so that we create more awareness on the same. So we really do appreciate that. And now, as we've now come to the end. My name is Dr. Agnes Karingo Karume from Kenyatta National Hospital. Been taking you through this session. For tomorrow, we have another session at the same time, 2 p.m. to 3:30 p.m. The African Surgical Outcome Study. We are encouraging collaborative research in clinical care at Kenyatta National Hospital. You are welcome to join us and to take part in this. Thank you and have a good afternoon.
Thank you and bye.